Good afternoon, Mr. Mayor and esteemed members of the City Council. My name is Steve Fernandez, and I am joined today by Veronica Gutierrez and Alicia Lozoya. We appreciate the opportunity to speak with you and to contribute to the City of Sacramento's ongoing commitment to public safety and community well-being. Our purpose today is to present a focused, data-informed discussion on the growing crisis of pedestrian deaths and injuries nationally, statewide, and within our regional communities. We would also like to propose policy to reduce pedestrian fatalities by targeted safety interventions. As pedestrian fatalities continue to rise across the country and in our state, the urgency to examine contributing factors and explore effective, evidence-based solutions has never been greater. Together, we hope to share key trends, highlight areas of concern, and support the Council's efforts to advance policies and infrastructure that protect all road users. We want to thank you for your time and for your leadership on this critical public safety issue. According to the National Highway Traffic Safety Administration, pedestrian injuries and fatalities in the United States represents a growing public health emergency with severe human and economic consequences. In 2022, pedestrians accounted for 18% of all traffic deaths, totaling 7,522 fatalities. That's a 0.7% increase from 2021 and the highest number recorded since 1981. Injuries rose sharply as well, with 67,336 pedestrians injured, marking an 11% increase from the previous year. On average, a pedestrian is killed every 70 minutes and injured every 8 minutes. Over the past decade, pedestrian fatalities have surged 78% since their 2009 low point, reflecting a long-term upward trend. Environmental conditions significantly influenced fatality risks. 76% of fatal pedestrian crashes occur in the dark. At nighttime, pedestrian deaths increased 84% between 2010 and 2025, compared to a 28% increase during the daytime hours. One recommended policy approach we propose is the strategic investment in safer pedestrian infrastructure. This involves government management, appropriating direct funding, utilizing grants, or even policy mandates to support pedestrian safety projects. The expected outcome is improved infrastructure, such as expanded, well-lit sidewalks, protected and high visible crossings, and grade-separated walkways in high-risk areas, all designed to significantly boost pedestrian safety.
Hello, my name is Veronica. I'll be adding on to my colleagues' data with state information. As you'll see in the California map, pedestrian fatalities have increased from 2014 to 2017 to 2021 to 2024. And cost of traffic deaths is totaling $5.8 billion yearly, with young adults being the most impacted demographic. Although we will not be moving forward with this policy approach, an approach we considered was parking enforcement near crosswalks. This would implement a no parking within 20 feet of a crosswalk and no parking 15 feet from crosswalk with curbs. This is considered to be authority and sanctions, and the expected outcome would be increased compliance with parking restrictions to improve driver sightlines and minor behavior shifts near intersections. Thank you.
Hello everyone, I am Alicia Lozoya and I'm going to be covering the regional area of this project, which I chose Sacramento County. I found that severe injuries for people walking and biking have risen more than 40% in the past couple years in the Sacramento area, and those rising injuries and fatalities now translate into long-term disability, major medical costs, and millions in economic burden for not only the Sacramento area, but also families impacted. Our top regional recommendation is to launch a Sacramento-focused safety campaign paired with targeted enforcement under the banner, Safe Streets, Strong Sacramento. This approach uses inducements, oratory tools, and sanctions to influence safer behavior among drivers, cyclists, and joggers. By partnering with schools, employers, and community groups and combining education with high visibility enforcement at collision hotspots, we can drive immediate behavior change and ultimately reduce serious injuries and fatalities across the Sacramento County. This budget includes only the essential costs needed to run the campaign effectively. 2 staff positions, the project director and the program coordinator, are necessary to plan, coordinate, and carry out all campaign activities. Their salaries and fringe benefits reflect the staffing required to manage outreach, enforcement coordination, reporting, and day-to-day operations. Supplies are limited to 3 practical needs: office supplies for administrative work, printing and materials for campaign outreach, and incentives to support community engagement. Operating cost will cover the space that we need to rent or lease for a functional work environment and communication services that are needed to coordinate activities and stay connected with partners in the public. Equipment is included to ensure staff have the technology required to perform their duties efficiently. And a revenue line is included to reflect the citations issued as part of the enforcement component of the campaign, keeping the budget aligned with the sample format. Overall, each line directly supports the core functions of the campaign and ensures the project can operate smoothly and effectively.
And finally, we want to thank you, Mayor and Council members, for taking the time to hear these policy recommendations aimed at enhancing pedestrian safety. Your attention to this issue reflects a shared commitment to protecting lives and creating safer streets for all of us.